Jazz hands. Have you been sneezing a lot lately? Allergy season is in full swing.
But before you grab for a quick fix, there may be another solution to your suffering. Dr. Madan Kandula is here with the advanced ear and nose and throat specialist with some alternatives.
Yes.
Good morning. Thanks for coming in.
Thanks for having me.
I know people are thinking, like Nicole, whether or not this is just like a cold or does she have allergies?
Correct. And it's a very simple question and a very difficult question to answer without the right tools, basically. So, because what's happening when somebody has got an allergy, or if they've got a cold, or if they've got a chronic sinus infection, is that the nose is just stuffing up and trying to really kind of shut things down, whatever the cause. And it's hard to know. So, you got to kind of come at it with the assumption that it might be any of those things, and not with the assumption that it's, it's just a cold, or it's just allergies. And you kind of got to get beneath the surface.
So there's something, and it is the trees are popping, everything's kind of going on right now. So we know, don't hang your sheets outside, obviously, if you're allergic, those type of things. But are there more things that people can do?
Well, I mean, there's simple things. I mean, if you know what the stuff that's really bothering you, the things you're allergic to, then avoiding those is key, which is easier said than done a lot of times. I mean, especially if you're allergic to a lot of things outside, it's hard to be inside all the time. It's hard to be just sort of cooped up.
Sure,
absolutely. So, you're kind of stuck to some extent. And then once you get beyond that, then you get to medicines, either allergy pills or allergy nose sprays, which are great for what they can work on. So if your issues are truly allergy related, then they can help the cause, to a significant extent. But a lot of people have kind of a mixed bag where they've got some allergy issues, but in addition to that, they've got some anatomy issues, they may have some sinus infection issues. And so if you're just hitting that allergy target, that's fine. But if that's 10% of your issue and you got 90% of the trouble that's not getting hit, that's not good.
All right, so we're going to talk some about, you said anatomy stuff. And I've heard this a lot, deviated septum, but I don't really know what it is.
That means you can get a nose job.
Stop it.
So this is a deviated septum. I think
that's what they claim before they get
this is true. So this is a cut through the inside of somebody's nose, and that thing that says deviated is where the septum is. So that's the midline structure of the nose, and you can see on the picture that it's pushed over to one side, and that's really, really common. So many people have that issue. Most people who have that issue have no idea that they've got it going on because there's nothing wrong with the outside of their nose, but they've got a chronic obstruction on the inside of the nose. That picture showed one side, going on one side, but that can be going both ways. And so you're starting from a starting point where things are just tight. And so you got that tightness coming into this situation, and then if you throw allergies on top of it, or a cold on top of it, or a sinus infection on top of it, then you're really shut down.
Yeah. How do you figure out if they have a deviated septum?
The only way to know is to look. And and really with to have the proper tools to look in there and see what's going on. So just by looking, there's some folks whose septums are so bad that you can tell by looking at the outside part of the nose.
How's my septum?
Yours looks good on the outside. It's hard to do on the inside.
Oh, that's the whole story.
Exactly. But it can be, it's deceptive. It looks, typically the septum is just inside the nose as far as being able to tell if it's bent. But there's some folks who come in with, horrifically deviated septums. Look, outside looks fine, look in there, and it's completely plugged up, absolutely.
Okay.
What's an enlarged, what's that?
Turbinate.
Yes.
So turbinate is a word not many people know, but everybody has experienced enlarged turbinates. So this is going from normal to obstructive. So the little fleshy bits of tissue that you're seeing there, if you've ever had a stuffy nose ever in your life, then you've been on that severe obstructed side. Now some people live that way. So their life chronically, those guys are swollen and they're always stuffy, and that's just life for them. And there's other folks that they can stuff up and shrink down temporarily. For the folks who have that chronically swollen, stuffed up turbinate, there's things we can do where we can really just shrink them down on a permanent basis, open up the airways, quick in-office procedures, those sorts of things, which are, make a night and day difference for folks.
Stop looking at me. I'm not saying you might need to book an appointment.
But like I said, that's a very, very common issue between the septum, between the turbinates, those two things. If somebody is chronically suffering from a stuffy nose, then more often than not, there's something going on anatomically. Now, they may have some allergy issues on top of that, and they may have some sinus issues on top of that, but you got to figure it out first.
Yeah. Right. Nasal polyps.
Yep. These are
less
common. So polyps, this is the gross picture there.
We probably should have had a warning.
Exactly.
Wait a minute.
So those are polyps.
Thank you so much.
Exactly. Well, breakfast is over at this point.
Wait,
so,
if that's in your nose, do you know?
No.
Really?
Not necessarily. I mean, so folks who have polyps, so not everybody has polyps by any means. But folks who have polyps, they usually start off with some degree of obstruction. They're kind of stuffy. And then those polyps, if they form, they progress, and so they get bigger and bigger, and so you go from, boy, I can't smell, and then, boy, I'm getting some headaches, to, boy, I can't breathe out of my nose, and then, you know, some folks come in and they're just completely shut down. Like their
They
nose
might
isn't
be
working at
thinking all along that this is allergies or something, but if they come to a doctor like you, they can figure this out permanently.
Exactly, yeah.
Instead of just taking the over-the-counter medications that I know so many people do right now.
Right.
They're just
exactly. I mean, the thing is, I guess if those medicines, the medicines are fine and they work well for what they work on, they can't do anything with polyps. They can't do anything with the deviated septum. There's certain things that they're not able to do anything with. But if you've got, you know, if you're 98% shut down and you get 2% back by using a nose spray, that's something.
That's something.
But I mean, it's better than nothing. But it's not the way it ought to be.
Huh.
Good,
So,
thank you.
Enlightening. Thank you.
You
I'll
win
get
the
your
award.
card before you leave. I'm a wreck. All right, a restaurant coming up that specializes in soup.
Yep, only soup.
Only